Hey guys, hey, how you guys are doing? Is you guys are doing because I'm doing better. I've got a lot to cover in a short amount of time. So I've got chili cooking. I'm doing a lot of stuff. Like a lot of things have changed. Had my flu shot yesterday, so today I feel kind of but you never know. With flu shots, sometimes I actually get sick, sometimes I don't. So I know I haven't been making very many videos lately. I hope that's going to change. I always say that, but life has just really been kicking me in the teeth. Like it's been so hard, and things are finally starting to look up for me. Um, which is why like I'm coming out a little bit more and I'm starting to feel a lot better mentally because you know how much I hate this place and like there's a lot of stuff happening and like I can't talk about all of it right now just because like I don't know times and dates and things like that, so I don't want to get anybody excited for anything that I know for a fact isn't happening yet. um, but I could use some positive thoughts like you have no idea. Like I could use some prayers that you just you can't even with what I need. If we can get all this done, it will be a miracle for me. It will change my life forever. So I met with my bariatric surgeon. His name is Dr. Fromm, and he's the best in the area. And he's amazing. So he actually knows all about the distal bypass because he gives his patients a distal bypass. And of course, I'm going to get emotional. I can't really help that I'm going to get emotional, but it's just being validated for once is something that I've never had, and it makes me feel so good about myself. It's just so um I went in there and he doesn't go by BMI. We talked a little bit about my case and how I am, and like he took a look at me and everything, and he feels like I am done. He's like, you're in maintenance. You've been in maintenance for a year. You haven't gained 20 pounds. Like maintenance is between 10 to 20 pounds. He's like, you haven't even gotten that far. He's like, your levels look great. Like I just had a whole bunch of like tests. My estrogen is really high, which we don't know why. It's like 474. But another thing, my A1C is 4.2. The lady who did my A1C came back to me because we did it in the endocrinology office and said she has never seen somebody with an A1C that low. So my A1C is 4.2. We'll talk about that with her later because I haven't heard back from my endocrinologist. So I saw my endocrinologist yesterday, but let's go back to Dr. Fromm. So, you know, he made me cry. Like, he made me really, really cry. He was like, you don't have to fight anymore. You don't have to constantly, like, beat yourself up. He's like, the amount of weight that you have managed to lose and the way that you go to the gym despite how many things are wrong with you, like he's like, I am not only impressed, but he said that, you know, he was just in awe and that he thinks that I am completely done. He's like, you are where you need to be. Don't worry about getting to 180. That's a ridiculous thing for them to ask you to do. He's like, just because your BMI is one thing doesn't mean that you need to lose more weight. He's like, I don't tell my patients that they need to get at like what BMI tells you is goal. He's like, in my opinion, what you have left is skin. He's like, in my opinion, he's like, what I see from you is that, you know, you're a fighter, you're a survivor. He's like, I'm so pleased to meet you. I want to take on your case. I'm happy that you're here. So we're gonna check out a few things. I go for CT and barium swallow. because he wants to see my rapid dumping syndrome, because obviously I haven't had a CT like that in a long time. So probably 2 or 3 years. And so we're getting that done on the 12th. On the 5th of December, I'm having an EGD done with him so he can take a look inside and see how everything is working. Like, do I have any ulcers? Do I have anything? How does my pouch look? Like, how big is it? Like, is well, like, what's my stoma look like and everything else. What I can tell you is that I have elected for him to go in and tighten the bottom of my stoma. Um, he has to do the EGD first, and then we'll talk about when we can schedule that. He said it's it's a outpatient procedure. He would go in with an EGD, like an EGD, and just stitch and tighten the stoma to where like a sleeve or somebody with a sleeve would have that sort of restriction, and it wouldn't be able to stretch back out. So he's like, that could help you in a lot of ways. And so we talked about doing that. He's like, you don't need a revision to anything. It's not that I asked for a revision for anything else, but because I have low blood sugar, and because I'm constantly hungry. He's like, what could really help you is having a stopping point. He's like, if you were able to keep food inside your pouch a little longer, he's like, that could really help you in, your blood sugars especially. He's like, I am worried about that because I have hypoactive glycemia. Um, so he's like, that could really fix that. He's like, had you come into my office as big as you were, he's like, I would have given you the duodenal switch. He's like, I wouldn't have thought twice about it. But of course, we've talked about that. That wasn't my path. I've had to go through all of these things because that's my path. Um, but I will be having that done, so that's exciting for me. Um, it's also reversible, so if I was to get sick or something was to happen, I would be able to get that reversed just by going in there and taking out the stitching. So, I am pretty excited about that. That will give me um, essentially a sleeve. Like, I mean, they're not cutting anything, but I'll have the restriction of a new gastric bypass patient or somebody who just got the sleeve done, which I think is going to be amazing. Um, he said, we're not doing it for weight loss. He's like, you probably will lose some more weight just because, you can't get in as much food. But he's like, you're going to feel a lot better in the long run because you won't feel constantly like your sugar is dropping. So I don't know if anybody cares or, this is interesting or not, but if you guys want to follow me through that, like, I'll take you through that and talk you through like how it's going and, how it makes me feel. And I don't know anybody else who's had that done. So this will be my fourth weight loss surgery. Um, this will be my fourth, so that should be fun. But the EGD, just to look at everything, will be on the 5th of December. Um, so like I'm just excited. I'm asking for a podiatry um, to get my broken toe, the one that we've talked about many, many times. I have a broken toe that I broke when I was 2, and my parents weren't able to get it fixed. So it's like broken like this, but on the side. So where the toe, instead of like with being like that, like it's broken, and then it's like way over here. So it's broken that way, like a candy cane. And so it causes me a lot of pain if TRICARE, and I know TRICARE will, if there's really, really amazing doctors here. So I'm going to take advantage of that and get that fixed. That will allow me to wear shoes that are appropriate to the size of my feet, because I currently wear a size 10 and I actually wear a 9. So I've been wearing shoes most of my life, well, all of my life, that are usually a size or 2 sizes bigger than what I actually wear, just because that toe bothers me so much. So I'm going to get that taken care of and looked at. Um, Like I said, my estrogen is really low. No, my estrogen is super high. We don't know why. Um, I'm going on Prevera, a 10-day. Um, it's progesterone, pretty much. It forces you to have a period. So if there's any guys that watch la 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 la, la it forces you to shed the walls of your uterus because I don't have periods, and that's exercise based because I exercise way too much. Technically. So pretty much that's what I'm dealing with is that we're gonna do that every couple of months. Um, maybe every 6 months we'll take a round of progesterone and make sure that everything's looking good in that way. Because the walls can get really thick and just gross. So since I'm not technically shedding all of that every month like most women. So we looked into having PCOS. I do not have it. No one has ever told me I've had it, but I always ask about it because of the fact that I can gain weight. I have no precursors of that. I have no precursors of actual diabetes. Like I said, my A1C is super low. Um, so they only have it at 4.1. So I'm only one step above like the lowest. So the chart goes from 4.1 to like I think 14. But like I said, mine is same. My vitamin D level is 36 point something, which means that I'm not low, but I'm on the lower end. She'd like to see it at 50, so I'm going to go back. I kind of cut myself down on taking the D3 that I was taking because I thought maybe I was taking too much. Apparently not. So I need to go back and take that. She wants me to take a B50 complex. So I'm going to go back and start taking a B50 complex. Not that any of my B vitamins are low, but it doesn't hurt to take that once or twice a week. Just, pop one underneath my tongue and be done with it. Um, she didn't get all of my labs back because she had ordered labs, which is my endocrinologist, and my doctor, Renez, which is my actual PCM, had ordered a bunch of tests. So they had doubles. So one set got sent to Dr. Renez and the other set got sent to her. So she didn't have all of those. But my selenium, my copper, my zinc, my vitamin D, all of those things, my estrogen, a lot of like the things that she could see, everything came back perfect. She was very surprised with somebody with has as much malabsorption as I have. She asked me what kind of vitamins and stuff I was taking. She asked me who put me on those vitamins, and I said I did. I did my research and I decided what I was going to take, and everything just looks great. Everything looks great. My A looks great. She couldn't see my K because that one didn't come back to her. My E looks fantastic. She said, all of that looks good. My vitamin D is on that edge. So I don't know if my vitamin K is low. We'll see because Dr. Renez will have that information. I don't know about my iron because again he will have that information. But I'm super interested to see how the other side of everything looks. I like to get a copy and kind of decide whether or not it's good or not. That chili smells really good. I'm excited to eat it. So I have gone back keto, which is high fat, high protein, low carb. I am going 29 net carbs. Net carbs means that you subtract sugar alcohols and you also subtract sugar alcohols and fiber from the carbs that you eat. So I've gone back to doing that mainly just because it makes me feel better. I'm As of yesterday, I was 242 fully clothed. We didn't take a lot of doctors here don't take off for clothes or what time of day that you might have been eating and drinking. So that's what I was. I would like to see 230 before my birthday. I think I can do that like fairly easy doing keto with just like a week or two, if that. I just want to see it. I think it would just make me feel really good about myself knowing that if I feel like it, like I can get down there anytime I want. But just having him tell me I was done, that I no longer, like, I had that conversation with the plastic surgeon in um, Florida, and he said by looking at my skin that I was done, but he's not a bariatric surgeon. So, of course, in my head, I was like, just because he says that I'm done doesn't mean that, my new bariatric surgeon would say something like that. But he was just so positive. He was just so nice. And he's like, I've never had anybody that's lost as much weight as you. He's like, I've never seen anybody who takes care of themselves the way you do after everything that you've been through. He's like, I'm really excited about your case. Like, you're no wonder you went and talked down in the Weight Loss Surgery Foundation of America's talks. He's like, you're a great candidate for the stitch. Like, he's like, you are a model bariatric patient. And that just meant a lot to me. That just means so much to me because I beat myself up constantly. I'm one of those people who are constantly like just hurting myself mentally because I never feel like I'm good enough. I never feel like I do enough. I never feel like I'm, working hard enough. I never feel like I eat as good as I can. I never feel like, I'm doing the best possible. Like, I never feel like that. And it's really hard for me to believe it, but when I finally get validation, and this is from, 3 people, because Dr. Rollins said that, he was really proud of me, but I was at 230 when I saw him. 12 pounds is neither here nor there, to be honest with you, like in the great scheme of things, but I think it will make me feel better to get down to 230 just because I know I can. Um, you know, as I lose weight, my face always does that sunken in thing right here. Like, it happens. Like, it's just whatever fat displacement. It takes it where it wants, from where it wants to, how it wants to. Only thing I can tell you is drink a lot of water. I drink a ton of water. Um, let's see. Is there anything else that I'm trying to get done? So I have something else that I can discuss, but I'm not going to. Well, actually, I have 2 things that I could discuss, but I'm just not going to do it on this video, just because I'm going to wait until it happens and then come back and tell you guys, like, how it went. But I'm pretty damn excited about it. I'm feeling better because lots of stuff is just going my way, it seems, at the moment. And, I'm ready for some changes. Like, I'm ready to see, like, what life is got in store for me. I finally found out, like, why I'm here, why me and Evelyn have been stationed here. And it's for surgeries and stuff like that. Like, I'm getting a lot of stuff done that, I would probably have a lot harder time, like my hands and my arms and stuff like that, that I would have a harder time getting done at another base. Just because this place is so small, and it's, there's not a whole lot of people here. So, um, another thing that I could talk about is that I had a lady who, I think I told you in my last video, I had a lady, and by the way, that thing was demonetized. Like, it would not allow me to monetize it because of YouTube hates me. Who pretty much manipulated me, and she told me that she was going to kill herself, and I was trying really hard. Even my wife was trying super hard to try to talk her out of it. She was just writing all kinds of horrible stuff. I'm not going to go into, like, because that's personal, but whatever. But, like, she was writing all kinds of terrible stuff about how and what she was going to do. And I spent like 2 hours trying to coerce her to give me her address so I could get her some help. She doesn't live here, obviously. She lives in Florida, And, I was trying desperately to try to find somebody who may have been a relative, or, just I'd called 911. I'd called the police in Orlando. I'd called 911 in Orlando. I'd called 911 here, because I was terrified this woman was going to do something. And um, she manipulated me. So she was just she didn't end up doing anything, thank God. But because of me calling and trying to get her help, and me trying to get a hold of somebody that could help her, she came back and she told me that, to mind my own goddamn business, and that, I should try fixing myself before I try fixing some other stranger, even though she contacted me and was telling me how she was going to kill herself. So I don't know what happened there and what a terrible person I was. And then she wrote on her wall that somebody sent me, because she blocked me, that, that I was harassing her and that I was harassing her family. And I was like, I didn't harass anybody. I was literally just asking if they knew her. That was it. That was literally, I don't know how that's harassing somebody, but okay. I will let you know. And me and my wife wrote a big post about it, like that if you come at me and tell me that you're going to harm yourself, I'm going to do everything in my power to try to help you. If that means that I have to piss you off, that I have to contact somebody that I think that might be your family to get you some help, if that makes you angry, then I'm the wrong person to talk to. If you get off on making people feel sorry for you and thinking that you're going to do something horrible and then playing on their feelings, like, I'm the wrong person for that. Because like I said, I will do everything, and Evelyn will do everything in our power to try to get you some help, because I am a suicide survivor, and the military has a lot of people who commit suicide, and it's not something that I take lightly. If you come to me and ask for help, expect to try to get somebody to give you help, because that's what I do. I care that much. And so she never wants to speak to me again. Well, then she never has to speak to me again, but at least I know that night she didn't do anything, and I did the best I could. I did everything that I could think of, and I hope that if I was in that situation, somebody would have done that for me. So that's all I can really say about that. So if nobody has told you today that you are loved, please let me tell you that. I love you. If nobody's told you today that you would be missed and that you're an amazing person and that you need to be here, I believe you do. I know you are here for a reason. I know I'm here for a reason. I would miss you if you weren't here. If nobody told you that you're kind and compassionate and beautiful, understand that everybody is beautiful in their own way. I know you're compassionate, or you wouldn't even be here. You wouldn't even be listening to me. If you're having a hard time right now, if things are going rough for you, please know that there always is a light at the end of the tunnel. You don't have to do anything. If all you did was get up today, I'm proud of you. If all you were able to do is just get up and breathe today, I'm so proud of you. I know how hard life can be. So I love your beautiful, gorgeous, amazing faces. I hope everyone is having a wonderful day, no matter where the hell you just happen to be in the world. And I will talk to you very, very, very soon. Bye.